I'm privileged now to introduce to you Senator Leah Vukmir, and she's done a great job for us, and she's been here every year talking to us, and we really appreciate that. So without further ado, here's Senator Vukmir.
Sorry that I couldn't be here for the breakfast. I was at an ROTC mom breakfast meeting, so I didn't. University in the Army ROTC program, and he will be stepping up to the plate to serve. And really an honor to follow my good friend Dan Sebring. He probably won't mind that I tell this story. Some of you have heard this story. Not everyone has heard this story, but how many of you remember the Congressman Sensenbrenner town hall meeting that kind of went awry during the height of the crazy occupation season 2 years ago? How many of you remember that? Had to shut down after doing 100 town hall meetings over the course of 100 a year for 30 years. Congressman Sensenbrenner had to shut that town hall meeting down after 30 minutes because of the protesters. And it was a bit chaotic. Representative Kuyanga was there as a freshman, wondering what in the world he got himself into. All the questions. If you've been to a Sensenbrenner town hall meeting, you know that he graciously invites the representatives and the senators to be there in case there are state issue questions that come up instead of federal issues, even though we all know that he can answer all the state issue questions as well. But he gives us an opportunity to have a platform. And that meeting shut down rather quickly. All the questions were thrown at me, and after 30 minutes it shut down. The room went rather chaotic. There was supposed to be an exit strategy for us, and we were waiting for it to happen, and suddenly I felt this arm come around me and lift me off the ground and whisk me through the crowd, and looked, and there was Dan Sebring getting into all the protesters. So anyway, thank you. I understand that there have been a variety of legislators talking about different topics, so I quickly took stock of what's been talked about, and I'll talk about something different, and that's healthcare reform, because that's certainly my area of concern. And we are so grateful that Governor Walker, almost 2 years ago, decided not to set up a healthcare exchange in the state of Wisconsin. And that is a really good thing. He, along with 34 other governors, made the decision not to create a state exchange. Right now, that has left the federal government reeling. They have no idea what to do because they thought all the states were going to set up exchanges, and now they've got to figure out what to do, A. B, and they've got to find the money for it. And the sticker shock of once they, and it's already coming out, the sticker shock of what this is going to cost is really going to create the dialogue, already creating the dialogue among our congressional leaders on both sides of the aisle about reforming Obamacare. I wish I could say repeal. Still possible. There are some people who are hopeful as some of these lawsuits make their way through the court system. Well, anyway, that's a really good thing. And the other good thing that you may know is that Governor Walker decided not to accept the federal health care money for Medicaid reform and under Obamacare. That is huge. And let me explain why. Because the federal government never follows through on their promises. You all know that in this room. And supposedly we were going to get this free money to expand Medicaid under Obamacare, and we all know that that free money just means it's coming out of your back pocket instead of your front pocket. And so thankfully Governor Walker and we in the legislature have supported him on this, because within a year or two, you know, the federal government is going to turn around, not going to give us the money that they promised, and now we suddenly are going to have a huge hole in our budget. So what Governor Walker has done is to make sure that the neediest of needy are protected, because after all, we are Republicans, we're compassionate, we want that safety net for those who need it, and then we will make sure that everyone else will be provided for care under the exchanges when and if they are created. But there will be a seamless transition. Here's what I think is going to happen. As I mentioned before, the sticker shock and the fact that there are these lawsuits that are going through the court system is really calling on our congressional leaders to create change in the federal bill. And these lawsuits shouldn't be taken lightly. The one in particular has to do with the IRS making the decision to sort of just by proxy change the law without legislative approval. And, you know, there's certain wars that kind of got started over, you know, taxation without representation. And we all know that, and that's basically what the IRS decided to do, to step in and become a super legislature and change the federal bill. So that lawsuit has a very strong chance of making its way through. In the meantime, what we are doing in the legislature is continuing on our push for consumer-driven health care reforms. My entire slate of health care reform bills are going to be coming out after the budget, and we will continue to preserve the great, robust market that we already have in Wisconsin. Wisconsin is very unique. Why should we create this federal program, a one-size-fits-all program for Wisconsin, when we know best how to care for our patients, our residents? And we have one of the lowest uninsured rates in the country. So let's take care of our Wisconsinites the way we know how to take care of them. So your team in Madison is going to continue down that road. Bottom line is the approach that we as Republicans have for solving health care actually gets to the root of the problem with health care, and that is the rising cost of health care. In the federal bill, you can call it PACA all you want, it's Obamacare. The federal bill never got to the bottom of the problem, and that's the rising cost of health care. So you have my commitment, along with my colleagues, to move down that path to help us preserve what we think is in the best interest for the people in Wisconsin. And as a nurse, I'm telling you, I've worked in some fine institutions here in this great state, and I want to make sure that the quality of care that I've been accustomed to giving to my patients will continue for me someday and for all of you. So thank you so much. You know how to find me. Contact me anytime. We've got a great agenda, and it's great to have Governor Walker and the majority in both houses to continue on the great works that we did from last session. Thank you for being there with us through all of it. We couldn't have done it without you. So take care. Bye.